Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Hello and welcome to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I am your host, Sarah, and I am happy to be with you here before the weekend to talk about health. Specifically today, we're going to be talking about breast health. As you can see from the title of this episode, men, I'm sorry if this topic makes you uncomfortable, although I'm sure there are women in your life who have questions about breast health, and it doesn't hurt to know. I'm sure they know things about your health that they didn't necessarily think they needed to know either. So, plus, breast health actually is important for men. You do have in pectoral muscles, you do have breasts per se, and men can get breast cancer, so it doesn't hurt to know a little bit about breast health even if you are a man. So this is a good topic for everyone, really. I'm going to apologize again for my scratchy throat. These allergies are never apparently going to get better. It has been a crazy spring here in Northern California. I was at the grocery store the other day, and the woman who was checking me out started to cough, and I said, "Oh, wow, you sound how I feel." And we had a whole quick commiseration session about the allergies, how horrible they are. So I apologize. Seriously, this is as good as it gets. I clear my throat, and I still sound like this. So it's just how we have to deal with it. At any rate, breast health, often something that we talk about during October, of course, because that is Breast Cancer Awareness Month. But this is June, and I started thinking about it because I have my scheduled mammogram coming up within the next week. And so I started thinking about that and about breast health in general as a good topic for a health and wellness podcast. Getting a mammogram is not my favorite thing to do. I'm just going to put that out there right now. It is awkward, it's uncomfortable, and you have to stand extraordinarily still, and then they, in this crazy weird position in order for them to get good images. But I do care about my health, and I care about your health as well. So we are going to talk about breast milk. Oh my goodness, where'd that come from? Breast health. A lot of this information does come from the Mayo Clinic. So we'll just have a discussion on breast health, and I assume I don't need to tell you what breasts are. Half the population has them. But breast health begins with a sense of what's normal for your own breasts. And that is, of course, breast awareness. You need to know what they feel like at different times of the month. You need to know how they vary in sensitivity, what their texture are, maybe how those things differ during your menstrual cycle. You should consider doing regular breast self-exams. You, of course, should always also go to your doctor once a year for a physical, and they will do a breast exam and possibly a pap smear if you're scheduled for that. But you definitely need to be familiar with how your breasts feel and the way they change. I know that there are times when I think, oh my goodness, did I just feel something? Is that a lump? And then I realize that, it's a certain time of the month. Maybe I'm ovulating, or maybe it's during my period. And so I realize, no, that's pretty typical for this time of the month. It is important to know the differences in your breast's sensitivity and texture so that you can know when to be concerned. For many women, of course, breast health includes concerns about breast lumps, breast pain, or nipple discharge. So when you know what's normal, then you can know when to consult your doctor. If you don't realize that you have different breast sensitivity or texture during different times of the month, then you may find yourself at the doctor for something that is completely normal. Although it never hurts to ask. When in doubt, go to your doctor. That is very important. It's also important to understand common screening and diagnostic tests for breast health, such as clinical breast exams, which I mentioned, mammograms, and breast ultrasounds. I have had all three of those, and the mammogram is definitely the weirdest. It's the most uncomfortable. Breast ultrasound, you just get to lie there in a dark room while they, it might be a little uncomfortable because you're lying there topless, but it is definitely not a bad way to go in terms of For me personally, I had an ultrasound on my breast when I had sort of an inconclusive mammogram result. So they just wanted more information and sent me to have an ultrasound. But I'm sure there can be other reasons for your doctor to recommend that you have an ultrasound. Now, of course, one of the main reasons that we do breast exams, whether self-exams or clinical exams, mammograms, etc., is for detection of breast cancer. A lot of women have questions about breast cancer prevention, so we're going to talk a little bit about ways that you can reduce your risks. I read recently that underwires contribute to the risk of breast cancer, but I haven't confirmed that, so I don't know if that is an accurate study or not, but it's something to think about. It's kind of an interesting theory. So if you are concerned about developing breast cancer, and you might wonder what are some steps that you can take. Of course, you need to know about your family history. If you have a family history of breast cancer, then you want to make doubly sure that you're monitoring, but everyone needs to monitor their breast health. Research does show that lifestyle changes can decrease the risk of breast cancer, even in women who are at high risk. So some of the things you can do to lower that risk: limit alcohol. The more alcohol you drink, the greater your risk of developing breast cancer. The general recommendation, which is based on research on the effect of alcohol on breast cancer risk, is to limit yourself to less than 1 drink per day, as even small amounts increase risk. The next one is don't smoke. Of course, we hear this always in terms of all kinds of cancer. Evidence does suggest a link between smoking and breast cancer, especially in premenopausal women. Controlling your weight, that of course has numerous health benefits, but being overweight or obese increases your risk of breast cancer. This is especially true if that obesity occurs later in life, particularly after menopause, which of course, you're sitting there thinking, well, great, because menopause is when our bodies change and it's harder to keep the weight off, right? Unfortunately, but it can be harder, but it is very, very important to try to control your weight to prevent that breast cancer possibility. And related news of controlling your weight, also be physically active, because physical activity can help you maintain that healthy weight, which then helps prevent breast cancer. Most healthy adults should aim for at least 150 minutes a week of moderate aerobic activity, or 75 minutes of vigorous aerobic activity weekly, plus strength training at least twice a week. If you aren't sure what type of activity you should be getting, talk to your doctor. Don't just start in on some activity, especially like, I'm just gonna do the moderate activity. I'll cut that in half and run do 75 minutes of vigorous aerobic activity. Well, your body might not quite be ready for that. So know your body, talk to your doctor, and then do that. Here's an interesting one. Breastfeeding might play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Of course, this doesn't work for every woman. Not every woman can breastfeed. Not every woman has children, so they do not breastfeed. But for those of you who have children and have breastfed, well, you have reduced your risk, and the longer you breastfeed, the greater the protective effect. So that's just a symbiotic relationship. Breast milk gives babies immunity, and the baby's feeding on the breast milk give us greater protective effects for breast cancer, which I think is very cool. What else can we do? Limit the dose and duration of hormone therapy. Combination hormone therapy for more than 3 to 5 years increases the risk of breast cancer. This information came out a while ago and kind of had women scrambling to figure out, postmenopausal and menopausal women scrambling to figure out what they could do differently to kind of relieve some of those menopause symptoms. So if you are taking hormone therapy for menopausal symptoms, ask your doctor about other options. You might be able to manage those symptoms with non-hormonal therapies and medications. If you decide that the benefit of short-term hormone therapy outweigh the risks, then use the lowest dose that works for you and continue to have your doctor monitor the length of time that you're taking those hormones. And of course, this one is, I think, relevant to all kinds of cancer, and that is avoid exposure to radiation and environmental pollution. So medical imaging methods such as computerized tomography use high doses of radiation. While more studies are needed, some research suggests a link between breast cancer and cumulative exposure to radiation over your lifetime. So reduce your exposure by having such tests only when absolutely necessary. So those are some things that you can do to help prevent or lower your risk of breast cancer. We're going to talk some more about some of those things that you can do and pay attention to after this break. Stay tuned. You're listening to the GSMC Health and Wellness Podcast, and I will be right back.
Still on the search of that one true love? On the limbo in this crazy world of dating, marriage, relationships? Well, listen to the Golden State Media Concepts Relationship Podcast, your one-stop podcast for everything about relationships.
Welcome back to the GSMC Health and Wellness Podcast. We are talking on this episode about breast health. And before the break, I was going through a list of some things that you can do to help reduce your risk of breast cancer. One question that people often ask is, what about diet? Can eating healthier or having a certain kind of diet prevent breast cancer? Now, eating a healthy diet might decrease your risk of some types of cancer, as well as diabetes, heart disease, and stroke. For example, women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts might have a reduced risk of breast cancer. The Mediterranean diet focuses on mostly plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil over butter and eat fish instead of red meat. But maintaining a healthy weight really is a key factor in breast cancer prevention. So definitely talk to your doctor, talk to a nutritionist if you are going to do a lot of research, if you're going to do a diet that you are hoping might prevent breast cancer. There are, certainly things that you can do to make yourself healthier. Another question that is asked, we talked about the hormone therapy, especially for women, post-menopausal and postmenopausal women. A lot of people then ask, okay, so is there a link between birth control pills and breast cancer? And there is some evidence that hormonal contraception, which does include birth control pills and IUDs that release hormones, there is some evidence that does increase the risk of breast cancer. But the risk is considered very small, and it decreases after you stop using those hormonal contraceptives. There has been a recent study that showed an association between hormonal contraceptive use and breast cancer, determined one additional breast cancer could be expected for every 7,690 women who use hormonal contraception for at least 1 year. So again, you should discuss your contraceptive options with your doctor. You should also consider the benefits of hormonal contraception, such as controlling menstrual bleeding, preventing an unwanted pregnancy, and reducing the risk of other cancers, including endometrial cancer and ovarian cancer. Sometimes there are other health benefits. My doctor has increased my birth control, or put me on a different birth control to try to help my menstrual migraines. So, there's all kinds of things that you need to talk to your doctor about and be aware of when you are choosing a contraceptive method if you are wanting to go on a hormonal contraception. What else can you do? Well, again, know your breasts and be vigilant about breast cancer detection. Do those monthly exams. They don't take long. If you're lying in bed and you're about to go to sleep, well, just do a quick breast exam. Or if you're in the shower, do a quick breast exam. The slippery soap really helps to kind of, get in there and feel things. Remember that your breasts, actually, you need to feel not only your breasts, where you think of your breasts as, the bumpy bits, the lumpy bits, but up into your armpits. You need to be feeling in there, because breast cancer you can get lumps there that are related to breast cancer. So if you notice any changes in your breasts, such as a new lump, such as skin changes, consult your doctor. Also ask your doctor when you should begin mammograms and other screenings based on your personal history. That age can vary for women depending on health factors and family history. So basically, hopefully you have a good relationship with your doctor and you feel comfortable discussing breast health. In terms of my own breast health, I learned a couple of years ago that I have dense breast tissue. I don't know why nobody had mentioned this before. I don't know. I guess I hadn't really started having regular mammograms. I'd had one mammogram in my early 30s after some concerns, and then another one more recently. And I was told that I do have dense breast tissue, which makes it harder to sometimes detect lumps. It just makes it harder to visualize on the mammogram. So that is one of the reasons why I have had a breast ultrasound, was to just make sure that there was nothing abnormal. So that is something that is sometimes recommended for women with dense breasts. You may wonder what this means, what it even is, and what it means for your breast cancer risk. That was something that I was concerned about, because dense breast tissue makes breast cancer screening more difficult. It does then increase the risk of breast cancer. So, for instance, not every woman has to have a mammogram every year, but my doctor has recommended that I do it every year, just so that they can monitor any changes and just keep an eye on things, since it is harder to detect with a mammogram. Definitely review your breast cancer risks with your doctor and consider your options for additional breast cancer screening tests. And then, so your doctor can say, well, do it once a year, or follow up with the breast ultrasound, whatever. Together, though, with your doctor, you can decide whether or not additional screening tests are right for you or even necessary. Now, what is dense breast tissue? That is a very good question. It refers to the appearance of breast tissue on a mammogram. It's normal and it's a common finding. So breast tissue is composed of milk glands, milk ducts, and supportive tissue, which is the dense breast tissue, and fatty tissue, which is the non-dense breast tissue. When viewed on a mammogram, women with dense breasts have more dense tissue than fatty tissue. That's really all it is. You have either supportive tissue or fatty tissue. I don't know. I don't think there's a good or a bad reasoning behind it. But on a mammogram, non-dense breast tissue appears dark and transparent, whereas dense breast tissue appears as a solid white area, and that can make it difficult to see through. So it can make it more difficult to detect any lumps or any changes in your breast tissue. How do doctors determine if you have dense breast tissues? That would probably be the radiologist who analyzes your mammogram and can determine the ratio of non-dense tissue to dense tissue, and then assign a level of breast density. Those levels are described using results a results reporting system called Breast Imaging Reporting and Data System, which is abbreviated as BI-RADS. The levels of density are often recorded in your mammogram report using letters, and those letters of density are A, almost entirely fatty, which indicates that the breasts are almost entirely composed of fat. B, scattered areas of fibroglandular density that so the first one, about 1 in 10 women has this result. The second one, about 4 in 10 women have this result. C is heterogeneously dense, which indicates that there are some areas of non-dense tissue, but that the majority of the breast tissue is dense. And again, about 4 in 10 women have this result. And then D, extremely dense, indicates that nearly all of the breast tissue is dense, and about 1 in 10 women has this result. In general, women with breasts that are classified as C or D are considered to have dense breasts. So about half of women are undergoing mammograms. Half of the women who are undergoing mammograms have dense breasts. So there you go. I actually don't know my letter. I should ask when I go have my mammogram, because I am curious now. Probably somebody mentioned it and it just went flying right out of my head. We are going to take our second break of the podcast. When we come back, we'll be wrapping up this episode on breast health. So stay tuned. You're listening to the GSMC Health and Wellness Podcast, and I will be right back.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back to the GSMC Health and Wellness Podcast, where we are talking about breast health. Before the break, I was talking about breast density, which everyone has. I mean, your breasts are a certain level of dense, regardless of size. So it just depends on how much supportive tissue versus how much fatty tissue you have. And you may ask, well, what causes dense breast tissue? And it's not clear why some women have more dense breast tissue than others. You may be more likely to have dense breasts if you are younger. Your breast tissue tends to become less dense as you age, though some women may have dense breast tissue at any age. If you have a lower body mass index, women with less body fat are more likely to have more dense breast tissue compared with women who are obese. Or if you take hormone therapy for menopause. Women who take combination hormone therapy to relieve signs and symptoms of menopause are more likely to have dense breasts. So I seem to not fit into any of those categories. I don't know why I have dense breasts. So it's just maybe genetics or luck. And you may want to know why it matters. Well, having dense breasts affects you in two ways. One, it increases the chance that breast cancer may go undetected by a mammogram, since dense breast tissue can mask potential cancer. And it also increases your risk of breast cancer, though doctors aren't sure why. So if you have dense breasts, then you're definitely going to want to talk to your doctor about options. There are other tests. As I said, you can do the breast ultrasound. You can do a 3D mammogram. You can do a breast MRI or an MBI, which is a molecular breast imaging. As I said, talk to your doctor about what options may be right for you. He or she may not suggest any of these, but just it's important to know if you have dense breasts, what you can do about it and what you should be looking out for. So one last thing we'll talk about on breast health, and that is how often you should do mammograms. There is some conflicting information out there about this. Doctors do usually recommend that you begin getting mammograms at the age of 40 and continue those mammograms annually. When you begin and how often you repeat the screening is a decision that is based on your preferences and your discussion with your doctors. The Mayo Clinic recommends women and their doctors discuss the benefits, risks, and limitations of mammograms and decide together what is best. You have to balance the benefits of screening with the limitations and risks, and that is a key part of deciding when to begin mammograms and how often to repeat them. As I said, there is some conflicting information out there. Not all organizations agree on breast cancer screening guidelines, but most do emphasize meeting with your doctor to review the risks, limitations, and benefits of mammograms in order to determine what is right for your particular situation, for your health, for your family history, etc. For instance, the U.S. Preventive Services Task Force mammogram guidelines recommend women begin screening at age 50, and the American Cancer Society recommends women begin screening at the age of 45. But both of these organizations acknowledge that beginning screening at 40 may make sense for some women after considering the benefits and limitations of the test. So the Mayo Clinic says that their doctors continue to review studies about mammogram guidelines to understand what those studies mean for women's health, and changes to mammogram guidelines might or might not be necessary in the future as researchers continue to study this topic. Mammogram screening, unfortunately, isn't perfect. Nothing is. Another study concluded that despite more women being diagnosed with early breast cancer due to mammogram screening, the number of women diagnosed with advanced breast cancer hasn't yet decreased. The study suggested that some women with early breast cancer were diagnosed with cancer that may have never affected their health. Unfortunately, doctors can't distinguish between breast cancers that may spread beyond the breast and those that will remain confined to the breast. So annual mammograms remain the best option for detecting breast cancer early and reducing the risk of death from breast cancer. The main concern about mammograms for breast cancer screening is the chance of a false positive result. This means that an abnormality is detected, but after additional testing, it turns out not to be cancer. So this would be really, really scary if you had a lump or something that was detected, an abnormality that was detected, and then your doctor hopefully sends you for additional tests, and then you find out that it's not cancer. That would be a huge relief, but you can imagine the emotional roller coaster that something like that would happen. But still, it's better to have the testing and have that scare than to not know and have it advance beyond what might be treatable. This concern is especially prevalent in younger women in their 40s and 50s because those are the ages where you may be more likely to have that false positive. So if you have an abnormality, then talk with your doctor. The doctor may recommend doing some of those additional testing, and those tests may determine if the abnormality shown on the original mammogram isn't worrisome for cancer. In some cases, it may be necessary for a woman to undergo a biopsy procedure to remove a sample of breast tissue for testing. For many women, having a biopsy that confirms there isn't any cancer present is reassuring and doesn't increase anxiety. This actually happened to my mom about 15 years ago. They found a lump. They did a biopsy. It was proven not to be cancer, but she then had to have mammograms, I think, once every 6 months for a period of time until they determined that there was nothing to worry about, and then she was able to go back to her every year. So it's very important to pay attention to your body as a whole, but in terms of your breasts, pay attention to their texture, their sensitivity, what's going on with them, and just, note any changes, talk to your doctor about any concerns that you have, and do your research. Find out if you need to be having a mammogram every year, find out what's important for your particular family history. Do your research, talk to your doctor, and take care of those breasts. Thank you so much for joining me for the GSMC Health and Wellness Podcast. Join me again next time when we will be talking more about health topics of interest. Thank you, and be well.